Good morning to everyone. I am Dr. Daniel. I'm a consultant physician with 8 years experience. I'm currently working in Tirumala Mission Hospital, Ranipet, and I welcome everyone for this session. So, regarding World Heart Day, so as we are celebrating, so hypertension is an important risk factor for heart disease, and it has to be well controlled to prevent heart disease. So it's a very important risk factor to control. So what is blood pressure? First, understanding what is blood pressure. So blood pressure, when the blood flows through the pipes called arteries, so there's a pressure exerted by the blood on the walls of the arteries. So that pressure is called blood pressure. So it has got two values, upper value called systolic value and lower value called diastolic value. The normal blood pressure is 120/80. The blood pressure actually fluctuates as we do activities during a stress, emotions. It fluctuates, but a fluctuation, a higher range of BP with the constant being constantly there is harmful for our body, because as it exerts pressure on the blood vessels and it can damage the blood vessel wall. So what are the next thing is, so what is a blood pressure can be up to 140/90. It's a range. It's not blood pressure need not be 120/80 always. It can be a range. So when do we treat this blood pressure? Blood pressure we treat when it's 140/90. Okay. So next we'll see what are the symptoms of blood pressures. So most of the people who we see in our outpatient clinics are actually asymptomatic. They come for something else. They come for an operation, or they come with some other problem, and then they are found to be, their blood pressures are found to be very high. So most of the patients are asymptomatic, but some patients are symptomatic. This actually varies from patients to patient. So what are the common symptoms of hypertension? The most common symptom is actually headache, and the headache actually, severe headache actually, and then the headache might be associated with nausea, vomiting. Sometimes there might be tiredness, body pain. All these are symptoms. Okay. So why do we get BP? So BP actually, when we usually get BP as we grow older, but there are a lot of risk factors actually for BP. So your blood pressure can rise due to the following factors: mainly sedentary lifestyle and overweight or obesity. They call us obesity. When your BMI, your body mass index, is more than 25. So commonly we call them as fat people. So those people are more, they are more liable to get BP. And then people who drink excessive alcohol, and people who eat junk food, or and people who smoke much. These are the factors where risk factors of hypertension. And then those people who have diabetes, uncontrolled diabetes, also in the long run can have hypertension. This diabetes per se, uncontrolled per se, is a risk factor for hypertension in the later, because it's also a disease of the blood vessel. So okay, so what is the good news for everybody is hypertension is actually preventable. So what we can do is actually, so what we can do is, even we see nowadays, we see very young children getting diabetes. Main thing is the junk food. They eat a lot of this junk food, is rich in this maida. They eat that, and then they put on weight. So when there's a lot of weight, the blood vessels have to go inside the tissue to supply. So the blood pressure automatically rises up. So you have to reduce the junk food, then certainly cut down smoking, and actually alcohol intake should be reduced. Alcohol is a stimulant basically. So alcohol is a stimulant, so it stimulates the body, and at the same time you'll get blood pressure. Then daily walking and reducing the salt intake. Excessive salt intake also causes BP. So we ask them to avoid salty foods like all these chips and all these pickles, puppets, and all those things, and mainly walking. So we ask the patients to go for daily walking, brisk walking. Brisk walking meaning that when you walk, you should sweat for those 30 minutes. So these are the walking, reducing the salt diet, reducing junk food, and completely cut down smoking, and then reduce the and reduce alcohol intake, I think it will be better that they don't even start taking alcohol. So these are the factors. Then if the BP is not controlled by these methods, BP is still high, then we ask them to, we start medication. There are very good medications for BP. So we start the medications for BP and then monitor them. So that's all from my side. I wish all of you will have a healthy life by following healthy habits, and together together actually fight against this hypertension, especially to save our heart. And thank you everyone.